we try to look at, okay, when did the symptoms happen? What was happening in your life at that time? When do they get better? When do they get worse? So yeah, like I think anyone can do this. Just be your own detective of uh, your own symptoms because they happen because of the infinite wisdom of the body and trying to help you out through those symptoms.
Welcome to Beyond the Pain, the podcast that explores what it really takes to break free from chronic pain and reclaim your life. I'm your host, Leigh Brandon, and someone who's spent over 2 decades helping people get to the root cause of pain that no one else could explain. Whether you're dealing with long-term back issues, joint pain, nerve discomfort, or mysterious symptoms that just won't go away, this show is here to help you go deeper. Because beyond the pain, there's clarity, strength, and power waiting for you. Each week, we'll uncover the physical, emotional, biochemical, and energetic causes of pain and how to transform them. Let's dive deep into this week's episode. Today's conversation is one that really challenges how we think about pain, illness, and symptoms, especially when they don't seem to make sense or when they just don't go away. My guest today is Catia Batalha. Catia is a psychotherapist and yoga teacher, and she came to this work through her own personal journey with autoimmune conditions. That experience led her to explore the deeper connections between the mind, the body, and what many people would call intuition or inner guidance. In this episode, we talk about why symptoms are rarely random, how pain can become persistent or chronic when the body's earlier signals are ignored, and why the body may actually be trying to help us even when it doesn't feel that way. We explore psychosomatic conditions, the idea that the body is designed to be healthy, and why things like headaches, insomnia, inflammation, and chronic pain often get normalized rather than understood. We also discuss intuition, responsibility for our own health, and what it really means to listen to the body, not just physically, but emotionally and mentally too. This is a conversation about awareness, empowerment, and reconnecting with the wisdom that already exists within you. So if you've ever wondered why your symptoms won't fully resolve, or felt like your body is trying to tell you something, but you're not quite sure how to listen, I think you're going to get a lot from this episode. So let's get into it. Catia, welcome to Beyond the Pain. It's great to have you on the show.
Thank you, Lee. I'm very happy to be here. Excited.
Yeah, me too. Me too. So, Catia, I always like to start at the beginning. So, could you share a bit of your story? What was happening in your life when your autoimmune condition first showed up? And how did that experience lead you into psychotherapy and the psychosomatic field?
Well, I had a horrific disease called chronic acute autoimmune urticaria, which is a nasty form of hives, essentially. If you were being bitten by 100 mosquitoes at any given time, that's what urticaria feels like. It was a horrible disease that would go on for years, like every day. Nothing would really work in terms of medication, and I consulted with the top doctors in the world. I traveled to Pamplona to the best clinic in the field, and basically they were all saying the same thing. Well, try and control the symptoms because we don't really know what it's about, basically. What's at the root of it. And I was at some point in my life, I started studying yoga and practicing yoga, and I started to realize that things were more connected than I thought. Mind, body, spirit, all the things were somehow communicating, and my body was trying to say something. I just didn't know what. Later on, I studied psychotherapy and became a psychotherapist and started working for Auckland Hospital in New Zealand in a team that worked precisely with psychosomatic conditions. These are conditions that are psychological, but are expressing through the body. They're very much real. They present real, often nasty symptoms,
Mm.
but they just are psychological also in their nature. And we started working with those conditions. And what I realized, we saw a lot of people with skin conditions and autoimmune conditions. And we started to analyze the trends. And with urticaria, basically, what it is it's a condition related to the immune system. And the immune system is the system that's responsible for our protection. Physically, something attacks us, it protects us. But this also uh, relates to the psychology in our system. So if we somehow feel that the world is threatening um, psychologically, then our immune system will actually feel like there is something to protect against
Mm.
and will get activated. And this is what it was doing with my urticaria. Our system is quite intelligent, and this happened across the board. Every psychosomatic condition is that uh, our mind, when we go through something difficult, there's abuse, there's trauma, whatever, difficult situations, toxic environments, our mind can abstract from it. We can very well go on with our lives, have our job, keep going. But body and emotions are one. They can't be separated.
Mm.
So if we disconnect our mind from what's going on, the emotions will express through the body. So anytime that there is a disease in the body that is connected to the psyche, it's because we are somehow not really connected with the root cause of it. So I started looking at the root causes of my condition. And being in a condition in the immune system, I knew that it was about somehow my system thought I was in danger. And this related to things in my past, like I've been physically abused, I've been sexually abused, emotionally abused. So basically, the world felt like a dangerous place. It felt like, especially with males, that I was in danger. And I wasn't conscious of this. Like for me, I was just
Mm.
living life. There was
Mm.
no problem. But when I really started to meditate on it, to tune into it, to really tune into my body and ask, what are you trying to tell me? What are you holding? What I realized is that's what it was holding. Uh,
Mm.
Feeling scared of the environment. Males were dangerous. So once I realized that, it was a process of um, working through that and beginning to trust again and understanding how I could feel safe again. Which in my case is obviously each case is a case. In my
Mm.
case, that meant learning to tune into myself and realize when I need to say no, learning to set boundaries, learning to keep myself safe, all those things. When I
Mm.
learned to do all those things, I felt safe in the world. And when I felt safe in the world, my urticaria stopped and it never came back.
Mm. Yeah, it's interesting. You mentioned the word boundary, and what is your skin?
Exactly.
It's a boundary. And what is your gastrointestinal tract as well? It's a boundary to the outside world. I know we think, if we put something in our mouth and swallow it, it's inside our body. It's just not, right? Our digestive tract is just like our skin. It allows certain things through, but then it's there to protect us from things that shouldn't get through. And, it's interesting that when you don't feel safe, when you don't have those boundaries, that your physical boundaries actually show symptoms, right? And,
Mhm.
one of the things that I've understood for quite a long time is that any symptom is a signal to your conscious mind that something's not quite right. And it's trying to alert you to the thing you need to be alerted of. Because then, you know, there's an old saying that the first stage of healing is awareness, right? But if you're not aware of something, how can you heal that thing, right? So it's quite interesting, because I do work with people with skin conditions. I do work with people with gastrointestinal problems, and that issue that you just mentioned is quite common amongst people with those conditions.
Mm,
It's very
exactly,
interesting.
and me too. I see that on a daily basis, trying to make those connections to understand what is our system trying to say. And yeah, the skin is a big. We work with lots of people with eczema, toxic environments, or all sorts of autoimmune conditions, kind of along the same lines. Mm.
Mm, yeah, yeah, it's a really interesting subject. So one thing I just want to point out, and I know I can speak on your behalf when I say this, when you're talking about psychosomatic conditions, we're not saying it's not real, right?
Mm.
Because I know a lot of people out there when they've got pain or some kind of physical condition, if their doctor says it's all in your head, they often feel gaslit, right? They feel like, oh, they're telling me this isn't real, right? That
Mm.
it's just I'm making it up. It's just in my head. Well, it is correct. It is in your head, but doesn't mean it's not real, right?
Yeah, exactly. And that's a really important distinction to make. It just means that everything is connected. And I do believe in what I've seen so far, and I don't know if everyone will believe this, but I do believe at this point that the body should be perfectly healthy. And if it's not, it's asking us to listen to what it's trying to say, whether it's headaches, whether you have insomnia, whether you have menstrual pain, like the body is perfectly capable of being completely healthy. And people think everyone's got headaches. This is normal. I often ask my clients, "Do you have any body problems?" "No, I don't have anything." "Do you have headaches?" "Oh yeah, I have headaches." So it's just so normalized that they don't even identify it as a problem,
Mm.
And for me, every little thing is trying to say something. Why do you have headaches? Are you too much in the mind? Where's your creativity? Where's your intuition? Where's your heart? Where's your body? Like, are you connected to spirit? Are you connected to nature? All the different elements. Oh no, I'm just at work and then I come home and I'm so tired. I kind of have dinner and watch TV show. Well, you're in the mind all day, you know?
Mm,
So anything that happens in the body, for me, I believe it's trying to tell a story.
mm. Yeah. Do you know Ina Segal? Have you come across her? She
Don't
wrote a
think
book
so.
called The Secret Language of Your Body.
Oh yeah, maybe. Hmm.
Yeah, I interviewed her, I think it was last week, which was really interesting. But there are so many, modalities that suggest, what you're saying is that everything's connected. And I try to look at the human body like a little bit of like a roadmap almost.
Mm.
And, whether it's looking at, the chakras, whether it's looking at energy meridians, something that I'm not, um, I don't know a lot about it, but I know some German new medicine talks a lot about, okay, well, if you've got this condition, it's because of this, about it's talking about, certain traumas and conflicts and things like this actually cause certain conditions. It's not necessarily what, the medical community would suggest, although they're generally not that interested in what's causing a problem anyway. Um, but what I'm trying to say is there's so many kind of modalities that think along similar lines to what you're suggesting, is that the body's trying to tell you something, but it's trying to understand what that message is. And there's many different ways. And I would say there's different views as well. Like certain modalities would suggest, for instance, traditional Chinese medicine would say, if there's an issue with the lungs, it could well be grief because grief gets stored
Mm.
in the lungs, or if it's the liver, it's anger, etc., etc. And there are different views in different modalities. Um, Interestingly, in a couple of energy medicine modalities that I've trained in over the years, the kind of concept is that anything can cause anything. So
Mm,
rather than it be, oh, it's a lung problem, it must be grief. It's the concept is that anything could cause anything,
mm,
which I've seen with my own eyes as well. Because like I do a session with someone. So what I've been working with the last couple of years is the emotion code, and literally anything could cause anything. And I've had people have a session with me. They might have lower back pain, as an example. Their back their back doesn't come up at all, right? There's nothing to do with the back. Might be, and you might think, oh, well, did kidneys come up? Because kidneys is in that area, and we know kidneys can cause lower back pain. Well, no. What about the adrenal glands? Well, no. And then the person will ring me the next day and go, what did you do? My back pain's gone, right? So it's quite interesting, and I think probably as human beings and as practitioners, there's so much we don't really understand.
mm, for
Um, and I
sure.
think and I think my view is, and certainly, I've been studying the human body for 32 years, and I'm sure a lot of people realize that the more they know, the more they realize they don't know. And I think it's just so, so important to constantly have an open mind and be open to new things. Like, I mentioned German new medicine, and I watched a podcast on Alex Zek's podcast. I wouldn't say I watched it last week because it's 4.5 hours long. It took me it took me many many goes to watch the whole thing. And some of the things that the lady was saying, I thought, well, that's really challenging my current belief, but that doesn't mean that it's incorrect, right? Have an open mind that it might be correct, but also be open to know that that might not be the only answer. Because the other thing that I sometimes feel a little bit of resistance to is when someone says this is the only way,
Mm,
right? Which is kind of, and again, I might not be understanding it correctly, but my understanding, I've watched a couple of long podcasts on German new medicine, and my understanding is they're kind of saying, well, this is the way, right? And I
mm,
kind of think, well, it might be a way, but probably isn't the only way, right?
mm,
That almost sounds like a religion in the way that they say that, right? A lot of religions say, well, our religion is the only way to God, right?
mm,
And it's if you say, well, my modality is the only way to health, it's like, well, is it? Is that
mhm.
true? But it's just really important to have an open mind, I think. And like I say, there was a lot of things that were said were challenging my own beliefs, but I'm still open that my current belief is wrong, right? And I think
Yeah,
that's how we learn and grow, isn't it?
yeah. And I like that. I believe how I see it is you can have roadmaps, basically,
Mm,
and different roadmaps might lead to the same place.
mm,
You don't have to take that one.
yeah.
And for me, I place myself on the side of empowerment. So I like to have a roadmap that
Mm,
I'm also uh, skeptical to believe things unless I've seen them. So I actually like to try them out, see if they work. And if
mm,
not, then I discard them because there's just so much information out
yeah.
there. And if they
Yeah.
do, then I'll keep exploring.
Mm,
And you mentioned the chakras, which is
mm,
interesting because the roadmap that has really, really worked for me and that I've gone really deep with is the framework of the chakras and the teachings of yoga, psychology, yoga, philosophy. And actually, my dissertation has been on that topic because I believe that how that is empowering is it gives us a roadmap to understand the body. Because, yes, everything is ultimately connected to everything, but
mm,
then you can get lost in that, and then that's disempowering. And so, with the chakras, for example, like I could talk about this for a long time, but just to give very specific examples to show what I mean. So, for example, the first chakra, the root chakra, every chakra connects to certain parts of the body, certain
mm,
emotions in parts of the psyche, parts of the mind, and thought processes, and certain states of consciousness. And so, for example, with the first chakra, it's related to safety, to stability, to being rooted in the world, and and it is connected to the kidneys. So if it is, and other organs as well, but if you have a balanced first chakra, then you will feel safe in the world. You'll be a stable person who can see things through. You'll have well-functioning kidneys, etc. If your first chakra is not balanced, then you might feel a lot of fear. That's the main emotion that relates to this chakra. And your kidneys might be unbalanced, etc. So, and whereas if we talk about, the third chakra, then that relates, if it's balanced, you might feel willpower and determination and, have a very good functioning liver. And if it's not well balanced, you might have liver problems and feel angry a lot of the time and be
Mm,
very controlling or be a doormat. So it's like each chakra relates to particular energies and particular parts of the body and the psyche. And this is, in my tradition, why you would do yoga, is why you do yoga postures and yoga practices, is to balance the chakra that you're working on. And this was actually my path. And I've actually recently published a book about that journey of going through the chakras, how I've learned it, which is you spend a couple of months on each chakra, really balancing it, really going deep into what does it touch. And my dissertation was on this, on research about what are the emotions that relate to each chakra and what are the postures that will help balance it. And so that becomes empowering because you can see, like, okay, I've got a heart problem. How will I work on this? What can I do? Because the Western mentality, which I grew up with is, okay, you go to a cardiologist, they'll tell you what to do. Your body has no wisdom. Your psyche holds no wisdom.
mm,
Don't trust yourself at all. You will go to a doctor who will give you medication and fix you. And you do it because, I mean, what else would you do? Like,
mm,
there's nothing like empowering you to understand how you can heal yourself. And yoga,
yeah.
for me, what it provides is that you're an ability for you to be your own healer and
Mm,
an empowered sovereign being that knows uh, what are the energies that are at play here and how you can have an influence in healing them. Does that make sense?
yeah, absolutely. Yeah. I mean, the sad thing is that, the current medical paradigm disempowers you and
Mm.
conditions you to hand over your responsibility to someone else for your own health, right? And we know why, because that's a very profitable business model, right? When you have to rely on someone else who most of the time is going to suggest probably a lifelong medication, which, is very good for repeat business, which is very good to generate profits. And then when you get side effects to that pharmaceutical, then, well, they've got another one for that side effect. And then that's going to cause another side effect. And then now you're on that merry-go-round that becomes very difficult to get off of. I'm going to pause here for a moment to explain something that often comes up in my work. Many people explore nutrition to support their health, yet still experience symptoms like pain, inflammation, fatigue, or poor sleep. One possible reason is that foods considered healthy in general don't always suit every individual. That's the focus of a program I'm currently running called Beyond the Pain: Discover and Remove the Foods Fueling Your Pain in just 14 days. Over 2 weeks, participants are guided through a structured process that allows them to observe how specific foods affect their body, particularly in relation to inflammation and pain sensitivity. The goal isn't to label foods as good or bad, but to help people understand what works for them. Early bird enrollment is currently available, and full details can be found in the show notes. Now, let's get back to the discussion. One of the I've used this story quite a lot, but it's a really good one actually. Um, it's quite a few years ago now. I worked with a lady. She came to see me. I was actually in San Diego at the time, and before I met her, I had like a load of paperwork in terms of, what she was suffering from. And she had pain all the way down the left side. Well, not all the way down the left side. She had pain on the left side of her body. So it was her neck, shoulder, into the arm, left lower back. And she'd had that pain, I think it was 27 years at that point, and she was like 52. And, I was kind of going through the paperwork. So I like to try to build a picture as much as possible, even before I see the person, to get an idea of what could be going on and where I might need to look. And my first kind of thoughts were, okay, it's left side of the body, so that's female energy. That's kind of what I was
Mhm.
coming up with in my mind. And I know that issues in the neck can lead to issues in the lower back. But she had a fall, and she'd landed on her left arm, and the pain in her arm, shoulder, neck was since that fall. She'd fallen off a mountain bike, I believe. And then she'd had another incident around the same time where she'd hit something on her lower back. Now, obviously, those tissues probably would have healed within, I don't know, a few days, few weeks at most. But obviously, all this time later, she's still in pain. And so when I first met with her, so I'm thinking, okay, so neck, shoulder, arm, fifth chakra. Fifth chakra is to do with communication. Left side of the body, female energy. And I just said to her, I'm just curious, what's your relationship like with your mother?
Yeah.
And this like relatively quiet, shy woman just exploded. Don't talk to me about my mother. She never loved me. We don't get on. We haven't spoken for decades. And I was like, oh, I might be onto something here, right? And so I literally had 4 days with her, and I did physical analysis as well, and I gave her lots of education on the right kind of diet for her, and we went through lots of stuff. But what I focused on every day was um, a technique called nonviolent communication, and I taught her when she went back home to reach out to her mother and to explain to her mother how she felt as a child and how she feels now about their relationship. And about 6 months after I did some work with her, I got a letter to say, I can't thank you enough. Not only has my pain gone, but I speak to my mother every day. We're getting on really well, and I couldn't be more happy.
Mm.
Right. And so if you can read what the body's trying to tell you, I mean, it might not have been that one thing. And I'm sure, I mean, it's a long time ago now, but I would have had lots of other questions to try and narrow down exactly what was going on. It just turned out that the first thing I thought of was what was going on. Um,
Mm.
but I think it's why it's really important that when you've got, it could be pain, like, in your situation, you had autoimmune skin condition. It's if you can't work out what your body's trying to tell you, find someone who can read the body to try and tell you what it is your body's trying to tell you. Because then, as I said, the first stage of healing is awareness, and you can't heal unless you're aware of what it is you need to heal ultimately. And
Mm.
if you've got a skin condition, putting a topical steroid is not going to solve the issue that you feel unsafe, right?
Mm. Yeah, exactly. And if you take medication for it, it might feel good, but it might also suppress the symptoms. And the point is, we need to listen to the symptoms, which is why they're there in the first place.
Mm,
And it's interesting the example that you mentioned because it was she had pain in the neck and pain in the lower back, right? Which is interesting because pain in the neck, I found personally that it's usually quite literal. Like someone is the pain in the neck to that
mm,
person.
yeah,
And the lower back is often connected with lack of support, which would
yeah,
also make sense, like
yeah.
with the mother side. So it's just so literal, and yeah, very useful. And I think when I work with people, because I'm a psychotherapist, and when I work with people who have psychosomatic conditions or just any condition, we try to be like a detective. We
Mm,
try to look at, okay, when did the symptoms happen? What was happening in your life at that time? when do they get better? When do they get worse? So yeah, like I think anyone can do this. Just be your own detective of uh, your own symptoms because they happen because of the infinite wisdom of the body and trying to help you out
Mm.
through those symptoms.
Yeah, yeah. Yeah, so there's a few examples that we've mentioned, like the neck and the lower back. Have you got any other examples how pain or illness can show up in specific parts of the body, and what the location might reveal emotionally, psychologically, or even spiritually?
God, yes. I mean, there's endless combinations and situations, but so for example, the stomach. Sometimes it's because things are hard to digest. You know, something
Mm.
emotional in people's lives is hard to
And
digest.
obviously you're not talking just food, right? You're talking
No,
life,
not just food.
right?
Yeah, I mean emotionally.
It
It could be.
might be a relationship, might be someone's passed away, you might have lost a
Mhm.
job, all those kind of things, or you might have felt you've been treated unfairly, all those kind of things. Yeah.
Yeah, and remember the key concept. This is what we found in our team at Auckland Hospital. The key concept that we worked with, that is true across the board, is that the point of why these symptoms happen is because the mind is disconnected from what's going on. So it's things that people are often not conscious of.
Mm,
Because if they're conscious, then everything is integrated, and in your mind, you know what's going on. So let's say you're in a relationship, you know that you're not being very well treated, you know that you're not respected, etc. If you're connected with the sadness of that, the pain of that, it's probably not going to express through the body. When it expresses through the body is when the mind disconnects from it, even to a degree or fully, because emotions and body are one.
mm,
And so this is when the body needs to say something because you're not really aware of what's going on. And then a lot of people are in relationships where it's okay. It's okay. It's a normal relationship. He treats me well. She treats me well. There's no problem, is what we tell ourselves. But actually, um, there is control, or there is abuse, or there is disrespect, or there is, not really listening to boundaries. There's a lot going on that and I for sure have done this, ignore to try and keep it going because we want to keep love in our lives, because
mm,
we want to have the company, because we've invested so much into that relationship. So we often uh try not to pay attention to what's really going on. But the issue is not issue, it's almost like the great thing about it is that our body's not on board with that. It doesn't want us to be disconnected from what's going on. It wants us to awaken. It wants us to be aware. And I could include the soul in there. Our soul doesn't need us to be doormats. It doesn't need us to be the same as everyone else. It doesn't need us to be unhappy. What it wants is for us to wake up, and reach our potential and become more conscious, more aware, more sovereign.
mm,
And if we're not doing that, it will somehow influence our body and our reality to give us hints about how we're not in our sovereignty and we're not in our power, so that we can awaken and we can do something about it.
mm.
Mm,
Yeah, interesting. I was going to ask you because I think you might have just answered my next question.
mm,
Why is it in your opinion? Why? So the lady that I spoke about just now, she fell, she landed on her arm, she hit her back, and she ended up in pain for decades. Why, in your view, does pain become persistent or chronic from a mind, body, spirit perspective? Is it because of the disconnection? Is that kind of what you're suggesting, or is it more to it than that?
It's funny you should ask. There's a very specific yogi teaching about that. It says the universe gives you a nudge. If you don't listen, it'll push you. If you don't listen, it'll give you a slap in the face. If you still don't listen, it'll throw you under a bus.
Mm,
So if you've got a chronic condition, you're probably under the bus at that point. You know, you've missed a lot of signs. And I'm speaking from experience. Like I
mm,
have done that. I have been there and ignored all the signs and the red flags and all the flags. So because well, I really believe our soul is on our side. It's pulling the strings so that we become more conscious. And it's influencing reality for us to really look at those things that are not well. And a question that actually related to your example that people often ask me, either in the yoga course or in life or in psychotherapy is what about accidents? Like I can understand if it's a chronic illness, etc., it's happening inside of me,
mm,
but I have an accident, like I hurt my neck, like that's random, isn't it?
mm,
And what I say is, no, I don't think it's random
mm,
either. Because why did you hurt your neck and not your foot or not your lower back or not something else? It's because we have a fragility there. We have, because of those psychological conditions that the body's trying to express, that place in the body is more vulnerable. And therefore, if you have an accident, that's the one that's going to be hurt.
mm,
And also, if you have that vulnerability, it's also not going to heal as well. So, as you said, you know, she could have been healed in a couple of weeks, and in the end, it was decades.
mm,
Why? You know, because the body's still trying to say something. And I'm very much convinced that the best thing we can do is listen.
mm,
And at all levels, whether that's listening to the body about what we eat, like going to the supermarket and seeing what we're drawn to, or who we hang out with, or the activities that we're involved in, or, you know, I feel like the body is always telling us if we really fine tune that intuition, it's always guiding us. There'll be, when you tune into anything, you know, should I have coffee with this person or not? Should I drink alcohol? Should I do some yoga? I think because that deep soul wisdom is in the body, we have access to it if we train that muscle.
mm,
So there'll be kind of, for me, I feel it as it's either an opening, excitement, and relaxation in my body, or it's like a shutting down attention and or something not pleasant. And for me, that's how I know this is aligned for me or it's not. And tuning into that intuition for me is one of the most important things we can do because uh, it means that we have access to our inner guidance. And that's much more empowering than listening to whatever is being said at the moment, which is 100 different and opposite things. You know, one doctor will say like, eat meat, that's the best thing for you because this, that, and another doctor is saying don't eat meat, it's really bad for your body and processing, etc. And a spiritual leader is saying don't do it because compassion, etc. Everyone's saying their thing. So
mm,
how do you know? How do you know
mm,
what to listen to? And for me, that's the answer is within. It's listening
mm,
to our inner guidance and practicing that intuition because deep down we know, and I know this as a woman, possibly as a human being, the signs were there. My intuition was kind of there. I just didn't know how to listen, and I didn't know that I could.
yeah, yeah. I think it was the Buddha that said, "If you don't go within, you go without." Right?
That's a great one. I never heard that one before.
Yeah. So for people listening or watching, if you don't know how to tap into your intuition, just I would say try and get quiet. and go within,
mm,
because that's where the answers are, right? They are within. And, you know, I've had some experiences, both kind of informal training and just in general life, that have made me realize how powerful we are as human beings. Because, again, I think I've mentioned this story before, but I did a course about 20 years ago with a guy called Chris Attard, who's from Malta, and the course was called Mindscape, and it basically teaches you how to connect your right and left brain. Because when you can connect your right and left brain, your brain can actually tap into universal consciousness. And I'll never forget, at the end of the 2 days, he got us into pairs, and we had to write down the name and address of someone we knew, and give that piece of paper to someone we were paired up with, and they had to tell us as much as possible about that person. And I never forget, I'd sat through the whole 2 days, and now I'm sat opposite this woman, and she's given me a piece of paper, and I'm thinking, I'm not going to be able to do this. Like, how am I going to know anything about this person? But I just followed the procedure, and I'm first of all, I'm sat there just thinking, nothing's coming into my head, right? But then after it was only about 5 seconds, all of a sudden, I just started speaking, and I didn't know whether what I was saying was correct. It was just a feeling that came over me, and I just described this person. I just said, I can sense a big, strapping, tall guy with dark hair. He's wearing a black pinstripe suit. He's wearing a white shirt and a red tie, and he's got black, shiny shoes on. And the front feels cold, and his back feels warm. I didn't really understand what I was saying, but this is what was coming through me. And I've looked up, and this woman's looking at me with her mouth wide open. And I'm like, what? And then something came through to me, and I said, is it your son? And she went, no, it's not my son. It's my brother. She said, he's a big guy. He works in the City of London. She said he's got grey hair now, but he used to have dark hair. She said he works in the City of London. He always wears a black pinstripe suit with a white shirt and a red tie, and he always has very black, shiny shoes. And she said when people meet him, they think he's quite cold, but when they get to know him, he's a really warm person. And I was like, wow, I can do that. And then we swapped over, and she went through a similar experience. Like, she didn't think she could do it either. And then she described one of my friends to a T. And it just makes you realize, A, what we're capable of, but also possibly what our traditional school system almost prevents us from doing, right? Because it's all very, very left brain. It's all very logical. It's just memory, isn't it? Right. This is the truth. This is what you have to remember. And if you can repeat what we're telling you, you get an A, right? You're a good little boy or a good little girl, right? But actually, we're so much more powerful than most of us believe. And even now, you know, and again, I've done lots of different training where I've had similar thing. I mean, what I didn't tell you, the lady with the neck, shoulder, arm, lower back pain, I actually, even before we were given or allowed to look at the questionnaires that the person filled in, we had to write down the case study. We didn't know the person's name. We didn't know anything. And I got her symptoms spot on without even, right? So again, I was sat there thinking, I'm not going to be able to do this. But I wrote down her symptoms: neck, lower back pain. I didn't get it. I didn't know it was on the left side only, but I had neck and lower back pain. So when you think that, you think, well, how much ability do we really have? Because I'm sure it's not, it's not something that is special to me. I'm sure all humans can do this kind of thing. And this is another thing, and I haven't yet realized how I can use this, but for a long time, if someone is saying something and they're about to say a number, the number pops into my head before they say it. Right. And that's been for a long time. And even things like, there's a football match that's just about to start. The final score pops into my head. It's like, well,
Mm.
right. And just recently, the last few weeks, when people are speaking, the next word they're going to say pops into my head. That's a very,
Mm.
very recent thing. And even I was having a conversation. There was a few people there. There was a conversation I was having with my niece, and she was talking, and I literally was saying the next word as she said it. And everyone was
Mm.
like, "How can you do that?" I was like, "I don't know. I don't know how and I don't even know why I'm saying the word out loud, like as they're saying it. It's almost like it's an automatic thing." But the reason I say that is that I do believe that we've all got amazing abilities that we just haven't tapped into yet.
Yeah,
And and
absolutely.
and being able to understand what our body's trying to tell us is probably something our ancestors took for granted. They were probably able to do that. It was like for them, it was like speaking for us, right? But I'm pretty convinced that our education system, so-called education system, has probably knocked that ability out of most people. Pain can feel hopeless when nothing seems to make a difference, but pain always has a cause. And when you find the cause, you can influence the outcome. I help people uncover the biomechanical, nutritional, emotional, and lifestyle factors keeping them stuck and guide them towards lasting relief. If you're ready to understand why you're in pain and what to do next, book a discovery call with me at bodycheck.co.uk/consultation. That's bodycheck.co.uk/consultation. Now, let's get back into the show.
Yeah, absolutely. And that's exactly what I was thinking. There are just so many testimonies in Aboriginal tribes, in yogi communities, and even from my own life, like examples, uh, not that extreme, but I've read about Aboriginal tribes, etc., that they don't even use the spoken word to communicate. They can tune into each other mentally and understand what's needed and what's present and take action. And and they use their voice to sing, to laugh, to celebrate. That's why they would use their voice. But other than that, there's really no need because we can be tuned in to a degree that's not necessary. And yeah, I've had examples of that in my own life, and some are even in my book. It's called Echoes of the Timeless, by the way, where someone just asks me specifically, "Can you tune into this and uh, tune into your intuition and tell me, this or that, about myself?" And I'll tune in and I'll say something, and the words are coming out, and I'm thinking, "Oh my God, this is so out there. It's maybe it's going to be ridiculous because I don't know where that came from, but I certainly don't think that about this person." And of course, it's spot on. And I've had a similar situation to you. Uh, Not so much anymore, but I used to be a Reiki practitioner at some point, and I remember being in a session and just having this really clear vision of a specific toy that even the colors, the shape, what kind of animal it was, exactly that toy, and seeing a little girl play with it in a specific setting. And when the session was over, I described the toy, and she said, "Oh my God, that was my childhood toy."
Mm.
So it's just there's just so much evidence that the part of the brain we use is so small, and we are capable of so much more than that. It feels like, oh, this is so woo-woo. Is it really true? But yogis have been saying this for thousands and thousands of years. It's nothing new. It's just that science hasn't quite gotten there in some cases, but this is all real. Like with my clients, when I have a new client, they talk a bit about their emotions and what's going on for them because they want to tell me why they're here. And in my head, I'm thinking, okay, this person is going to have neck pain, lower back pain, and pain on the left side of their body and stomach problems. And sure enough, I asked them, okay, what's happening in your body? And they tell me exactly that, because at this point, I can already kind of tell how their body is going to show certain things. So it's very, very much real.
Mm. Yeah, it's interesting. I've actually said a number of times on the podcast that things that are woo woo are things that science doesn't yet have the equipment to measure,
Mm.
right? But you also reminded me of another experience I've had probably about 15 years ago. I remember a client of mine, she said, "Oh, I'm going to a psychic circle tonight. Do you fancy coming along?" And I thought, "Oh, yeah, that would be interesting." But at the time, again, kind of thinking, I've got no psychic ability, but I'd be quite interested just to see what happens. And somehow I spoke to a friend of mine. She's been on the podcast twice, actually, a friend of mine called Liz Wong. And she said, "Oh, can I come along?" And I was like, "Yeah, I guess so." So we went along to this psychic circle, and there was about 30 of us in the group. And the leader of the group did like a meditation to start, and then invited a spirit into the room, right? And I'm just kind of in a bit of a meditative state. And then the leader of the group says, "Right, I just want you to, you know, just connect with the spirit, and whatever comes up, we'll discuss it afterwards." And I'm kind of sit there again thinking, nothing's coming through, nothing's coming through, nothing's coming through. And then I start to see pictures in my mind of floor plans. So, I used to do technical drawing at school, and I actually ended up with a job where I used to draw floor plans on a computer system. So for the company I was working for at the time, that was kind of my role. And so I was very familiar with floor plans. So they're just kind of flicking into my head, but I'm thinking that's got nothing to do with this session that's going on. And then I was probably about the 10th person along in the group out of the 30. And someone starts saying, "Yeah, I could see someone building a wall." And then the next person would say, "I saw floor plans." And I thought, that's weird, because I saw floor plans as well. And then the next person would go, "Oh, I saw someone building a brick wall as well." And then it got round to me, and I said, "Yeah." I said, "Yeah, at first I didn't see anything. And then I started to see floor plans." And then I think my friend Liz was maybe about 5 people round from me. And she went, "Yeah, I didn't really get anything." And then she spoke for like 15 minutes about there was a guy in the class and he's just given up alcohol. His dad died recently and he was starting a new life. He was making plans for this new life. Now he'd given up alcohol. And she's talking, and this guy is crying, right? Because like his dad had just died. He's just given up alcohol. And she was just on a tee. Like she was speaking for quite a long time. I don't remember the whole details, but the whole group, because there was most of the people there were professional psychics. So we just went along just, for a bit of interest. And she just blew everyone away. And she'd never been to anything like that before. So again, the reason I say that is because we as humans have so much more ability than we realize we have. And so if anyone's out there thinking, okay, I'm in pain, or, I've got whatever condition and it's not possible for me to work out what my body's trying to tell me, I would say to you, you have got that ability. You got to believe that you have that ability. And I think, like I said earlier, or alluded to earlier, I think the likelihood is that our, far ancestors always had this kind of ability, and that's what's enabled us to be here now, right? That's enabled them to survive all this time. How many of us could survive on the savannah in Africa? Probably not many of us, right? So,
No.
yeah, definitely. I think people should definitely have belief that, they have the ability to tap into what their body's trying to tell them. But at the end of the day, if you don't, there are people like us that can help people read the map, right? So, what in your view? So, like my lady who, um, had her issue, so she had injuries, but they went on for a long time. Apart from, I guess, not listening to the message, is there any other reason why you think people have these long-term conditions?
I mean, there could be karmic reasons sometimes that's at play, where we've done some harm in the world and we've, put something out there and we actually are receiving that back onto ourselves. So that's a possibility. But even if that's the case, then there will be examples in our life where that's playing out, that we can learn from. So it's still visible. Whatever is happening is always visible. And I think usually a big challenge in that, and why a lot of people just don't even think they to do this, is that they feel disempowered. So they think, oh no, I'm not uh, I'm not smart enough, or I'm not resourced enough, or I'm just not capable enough, or whatever story, that they don't believe that they have healing capabilities, and they're capable of working through whatever is going on and coming out the other side. So yeah, for me, that is a big problem. But other than those two obstacles, it's usually simply the body speaking. And I've just got so many examples that I've seen people have,
Mm,
that usually at Auckland Hospital, we were like I, I, I don't want to say the rubbish team, but the team that patients went from doctor to doctor to doctor to specialists to specialists. And when they really couldn't do anything, they're like, there is a team somewhere. They do stuff. Like
mm,
when we don't know what to do with patients, we give it to them and they do stuff. So often people would get to me, uh, already quite really done with being in doctors and being in the system. And sometimes it had been decades that they've been working through something like that, this horrific chronic disease or whatever. And often we would um, they would find healing in a couple of months, or something like that. Not that it's guaranteed, but it would be
mm,
frequent that
mm,
things that they've been struggling with for a very long time would be resolved once they started listening to the message and making changes in their lives. And that's another big thing, is to take ownership of your reality. This is huge, because when people think, oh, that uh, my reality sucks because this person's like this to me, because those circumstances are bad to me, because it's everyone else's fault and responsibility, then again we're back to disempowerment. So I can't do anything, like people are just bad to me. Oh well, that's me, and that's not what the body's trying to say. The body's not just telling us, well, you're like this and you're hopeless, so that's how you're going to stay, and I'm going to give you these symptoms forever. No, it gives us those symptoms because it is totally within our power to change our reality. But we have to be accountable for our
mm,
behaviors, our emotions, our actions, and for me, that's the only way that we can actually see change, is if we are willing to change. Yeah.
mm. Yeah, I've got there's a couple of things I want to ask you about based on your answer there. So, and I'm going to tell you what both of them are in case I forget. So, in a moment, I'm going to ask you to share with the audience your view on what karma is, because you mentioned karma. And the other thing is, a pattern I constantly see in my clinic is that people blame their pain on the final movement they made, lifting something, twisting, slipping awkwardly. But the truth is, the body was already inflamed and stressed long before that moment. When you reduce inflammatory load from food, everything settles, joints move better, muscles relax, and pain becomes more cooperative. The Pain Free Plate shows you 7 foods that support that process. You can grab your copy at bodycheck.co.uk. That's bodycheck.co.uk/pain free plate. Now, back to the show. Because you started talking about responsibility, I want to ask you a question about archetypes as well, which you may or may not. I don't know if that's your thing, but we'll come on to that. But if you could just share with the audience what your view on karma is.
Karma is when out of ignorance we cause suffering in the world. That suffering essentially comes back to us, not in a linear way. If you slap someone, they're not going to necessarily slap you back. It might be that they don't say anything, and they go away. And, in another situation or even another life, that comes back to you because you've put an energy out there and it will come back in a causal way. So that means cause and effect, not necessarily a linear way. That's all it is. Does that make sense?
Yep. And then archetypes. Do you work with archetypes?
Depends. What do you mean
Yeah.
exactly?
So, when it comes to people taking responsibility for their actions, so I'm talking more about the survival archetypes. So the child, the victim, the saboteur, and the
Mm,
prostitute.
yeah.
Yeah. Do you want to talk a little bit about that?
There's many frameworks of archetypes that I've heard about that one. I don't
Yeah, that's
particularly work with
Caroline
it
Caroline
necessarily.
Mace.
Oh, right. Yeah. No, I work a lot with what I call the spectrum of disempowerment. You're either in the sovereign empowered side, where you believe that reality is responding to you and you are ultimately responsible for things that are happening in your life because you are attracting them because of your own emotions, traumas, behaviors, everything that you're doing is creating reality. And that's kind of an internal locus of control. And you know that if you change yourself and change your behavior or how you feel, reality will adjust. And I've seen this just so well in my life. Like reality is a mirror of what's happening inside of us. Um, so it's just always reflecting us. And you can look at a mirror and say, oh, that's really ugly. And blame the mirror. But the mirror is neutral, it's just reflecting you. So that's the
Mm,
spectrum of empowerment versus disempowerment, which is you're in the victim. You have an external locus of control. You think, oh, it's so bad. Everyone else is to blame for how I feel and my reality. I have no power in it. Whenever someone really comes to me in a situation where they feel they have no power, for me, there's just something we haven't figured out. And a lot of people do. A lot of people think I have no power in this situation. I cannot do anything. And I've seen that. I've seen that a lot I've seen it with mums. It's a very typical example. I have mums who are in a situation where they never have time. They never ever have time for uh, themselves and for anything. And I
mm,
have other mums and even single mums who they meditate and the child just goes and does their thing because they know that's mommy's time, and they've known from the beginning of their lives, and that's always been like that, and there's no option there. Or I also have hold a medicine song circle. It's like a healing song circle. And I have mothers who come and I ask them, mothers of three, like I have multiple mothers of three that come to my circle every week. And once I asked one of them, like, how do you do that? How can you come here? Like have the time every week to come to the circle? And she just said, whenever something is truly important, I do it. That's it. I find a way. Like there's a babysitter, there's this, there's that. Like there's a way. And this is that side of the empowerment. That's what I would say. But did you want to say a bit more about archetypes?
Yeah, no. I mean, I've done a whole episode on it a while back with a guy
Yeah.
called Greg Schmaus, who's studied with Caroline Mace's. Great episode if people want to look back on that. I want to ask you one more question before we wrap up. So, a friend of mine who's also got an amazing podcast. I've interviewed him twice for the show. He used to do Brazilian Jiu-Jitsu, right? The reason he gave up was because obviously in Brazilian Jiu-Jitsu you do things like chokes, where you got someone's arm around your neck and things like that, and he blew a disc in his neck, and he also had someone in a hold snap his ankle ligaments. And just to let you know, he's a former orthopedic surgeon, but he's kind of very open to things. But he will say to you, well, there's nothing more to it. Some guy just grabbed hold of my ankle and he snapped my ligaments. What would be your response to that?
I would still say that everything is connected. Why was the guy drawn to the ankle in particular? Like he could have done anything. Any part of his body could have attracted this guy. Why the ankle? And the ankle is a thing that really sustains us, you know. It kind of holds our entire body. So it has a very particular role, and that got taken away from him in a way if he got injured there. So that means something about what's probably happening for him at some level emotionally. That's what I would say, just off the top of my head.
Yeah, it's interesting because we kind of had a conversation like this on his podcast when I was on his podcast. And I remember, so I studied an energy medicine called the Body Talk system many years ago. And I remember, and I think they were quoting traditional Chinese medicine when they were saying quite often the ankle is all about decision making. Because if you think about what does the ankle do, it allows us to change direction, right?
Mm.
So they were kind of suggesting that sometimes it's because you're not making a decision that you end up with an ankle injury. And I kind of suggested that to him, and he kind of really kind of poo-pooed it. Oh, that'd be stupid. It's because a guy grabbed my ankle, and he, and I just kind of smiled at him, and I just thought, right, I'm not going to kind of have that discussion now because there was loads of other stuff to talk about. But I just kind of smiled, and but he is very good at kind of coming back round and being a bit more accepting to different things. But yeah, who knows? Who knows?
And it's a symbolic language is what I would say, and is how we worked at the hospital. Something might have a slightly different meaning, or it could have multiple meanings, and you could have one or not the other. So it's not like we can say for certainty. Like, for example, I found a huge link between urticaria, like hives, and sexual abuse. But I can't say that everyone who's got urticaria has been sexually abused. So there's some hints, some things that we can keep an eye out for, maybe ankles is decisions, or maybe it's holding the weight of the body or whatever, but it's just having some loose ideas, but then it's only really the person who can look inside and feel like, am I really incapable, or is it difficult for me to make decisions, or is it difficult for me to hold myself? It's only really the person who can have that feeling of like, yeah, this is actually what's right for me, because it's very connected with the person themselves.
Yeah. In a Segal's book, she goes through the entire body, and let's say it's the ankle, and she'll have a whole list of potential things that could be going on. And these are things that she's discovered from her own intuition and working with people. And I know, she studied a lot of Carl Jung and Rudolf Steiner as well. So it's a really fascinating book, and quite often, if I'm working with a client, I'll grab the book
Mm,
and think, oh, they've got an issue here. Oh, what does she suggest it could be? And then I've got that on top of the chakras and all the other potential tools as well. But yeah, it's really, really, really fascinating.
Yeah, it's good to have those tools. And I have done a bit of research on that, and I found different authors who also have similar
Mm,
books about what does this mean, what does, that part of the body mean, and they don't always say the same thing.
mm,
So uh, for me, like if something is true, it can be confirmed. It's scientific, and everyone will be saying the same thing. And
mm,
because this is more subjective, this is more subject to interpretation, and it's very personal, it's good to, you know, and I would do the same. If I had a book that had all these suggestions, I would probably have a look, but hold that lightly because it's symbolic language is not always straightforward, and sometimes it is straightforward. And I worked with people, with heart problems that then discovered I'm so disconnected from my son, and that's so painful. And then they connect, and the heart problem is gone, and they'd been told that they needed heart medication for their entire life. So
mm.
sometimes it's just as simple as that. A broken heart, and sometimes it's not. It's something more complex, more symbolic that takes a bit more uh, digging into.
Yeah, on the odd occasion, I have literally read out the the potential causes to clients with a specific condition, and of course, it's not going to be all of them. And I always say to them, look, probably not all, because she's got multiple. But every single time I've done that, the person's gone, oh yeah, that's definitely me. You know, so it can be
Yeah.
quite useful, and it's interesting as well.
Mm.
Did my intuition say you need to go and get the book to read out to the
Mm.
person, right? Because it
Yeah.
might, you know, if my intuition hadn't told me to do it, maybe that wouldn't have matched, perhaps.
Exactly. Yeah, I really believe that. And I have the same with my clients. With one client, I'll be inclined to do something very specific. And with another client in the exact same circumstances, I didn't do that. I did something else.
Mm,
Why? And the more I believe that the more attuned we become, the more we purify ourselves, our mind and our bodies and all the things, the more we are actually accurate in those intuitions and do the right things at the right time.
yeah, yeah.
Mm.
Just one more thing. So,
Mm.
if someone's watching or listening to this, they're in pain, they've been in pain for a long time. What would be your kind of final message for them?
Don't give up. If your body is telling you something through its symptoms, there is hope. It is something to be understood. And if you learn to listen in a very deep way, then there is wisdom there to be learned and integrated. And once that happens, the symptoms might just go away.
Awesome. And what's next for you, Katia?
What's next?
Hmm.
In life or in this moment?
However you want to answer that question.
um, what's next is well, I'm in New Zealand, so it's 10:30 p.m. here. It's quite late, and I might just go and relax and have a quiet evening.
Cool. Awesome. And where can people find you online, and where can people find more about your work and your books?
Oh yeah. So my book is called Echoes of the Timeless, a journey of healing, awakening, and self-discovery, transformation, etc. You'll find it everywhere, pretty much anywhere that books can be sold. It's there. And my website is catiabatalha.org. And I'm on all social media, so feel free to add me and stay in touch.
Cool.
Thank you for
Yeah, and
asking.
I'll make sure your links are in the show notes as well.
Perfect. Thank you so much, Leigh. That's been a really awesome conversation, and I'm happy we were here.
My pleasure. So that's it from Catia and me for this week. But be sure to tune in, same time, same place, next week on Beyond the Pain. Thanks for listening to Beyond the Pain. If this episode resonated, please follow the show, leave a review, or share it with someone you know who's been struggling. And remember, pain is not permanent. With the right insight and support, you can turn it into power. Until next time, stay open, stay strong, and keep moving beyond the pain.